On this week's Poll Hub, COVID-19, the new normal? What are Americans doing, saying, and thinking? Well, we've got some answers. Plus, President Trump's approval rating. It's improved since the COVID-19 outbreak in the United States. Is it a bounce or a blip? We offer some historical perspective. This is Poll Hub, so let's get started. Hi, everyone. Welcome to Poll Hub. I'm Barbara Carvalho, Director of the Marist Poll.
And I'm Lee Miringoff, Director of the Marist College Institute for Public Opinion.
And I'm Jay DeDapper, Director of Innovation here at the Marist Poll.
Well, actually, you're not here at the Marist Poll.
He's remote.
You are remote. Lee and I are technically remote, too. We're just remote together. So, these
are unusual times. We are all well, and we're hoping those of you who are listening to us are also weathering this as well as can be expected.
Yeah, COVID-19 has certainly impacted each of us in different ways, from school to jobs to health. And one of the ways we keep tabs on how Americans are doing is actually to ask them. So that's exactly what a lot of polling organizations have been doing. So how have Americans been faring?
Well, first of all, the numbers, we talk about how poll numbers move over time and how they don't. Well, these have been incredibly sudden changes. I remember we were in the field doing a poll right before the New Hampshire primary. It seems like ages ago, different lifetime ago.
And the numbers were very different, totally very low.
We did a poll a couple weeks ago, and then we're going to see. These numbers are just so different now in terms of whether people think this is a major threat to the health, the economy, personal finances. All those numbers have skyrocketed to the point where people think 88% of Americans are telling us, actually this was a Pew Research survey, 88% said that this is a threat to the economy, 66% think it's a threat to the U.S. population as a whole in terms of health. People are worried about their own financial situation. So we're seeing lots of activity here in terms of public opinion responding and people taking steps to deal with this. And people are, doing the social distancing and those numbers in terms of not going to crowds, avoiding mass transit, avoiding public places. We're seeing people responding, although in different ways in different parts of the country. And I think that that's part of the slow yet dramatic realization that when it becomes serious in a community, people are now really adjusting their lifestyle.
Yeah, I mean, when we were back in New Hampshire for the primary, and people, right now, I think we're saying primaries, what primaries? Mm-hmm. Although I know some of them are coming around still to some states, haven't canceled them. But Jay, what are your thoughts in terms of how, how these numbers have changed over the last couple months and even in the last few weeks?
Yeah, it's actually, if you could be in the field day to day, I think you'd see changes. And there's three things that strike me about the current situation in polling. One is it's never been more true that a poll is a snapshot in time as to, the snapshot this second. The changes in people's attitudes about this have been so dramatic, so rapid, that any poll that was in the field 3 or 4 days ago has at least a reasonable possibility of not really capturing the mood of the public. The second thing that strikes me is that I wonder, and I don't know this because these were all national polls, but if the people who felt less worried 2 or 3 weeks ago were in states that were not as impacted. So in a national sample, obviously, it blends everything together. But do you have the northeastern region, for instance, or in the west where it was, it had hit earlier? Were those people more worried than they were in the middle of the country where it hadn't hit? And has everybody caught up to where we were, for instance, in the Northeast a couple of weeks ago?
Yeah,
I wonder about that.
You're right in terms of the red state, blue state, urban, rural differential, and that is the case. And no, people haven't necessarily caught up, but is likely as the penetration of this, as the contagion spreads, that people's views will then likely change. But there's no doubt, at least initially and for the first couple weeks of the spread, there was a partisan divide, which was an urban divide as well, in terms of Democrats, Republicans, and in terms of urban versus more rural.
Well, it is striking, and you talk about the snapshot in time, and has just been, literally weeks ago when we did that initial poll, and only about 1% of Americans had changed travel plans. Mm-hmm. They didn't feel that many of the responses and restrictions to COVID-19 were necessary, and I think we really have seen a consensus forming here.
Yes.
For instance, both Democrats and Republicans, 94% of Democrats, 96% of Republicans believe that restricting international travel to the U.S. right now is a necessary response to this threat. The canceling of major sports and entertainment events, almost 9 in 10 Republicans and even more Democrats feel the same way. They're on board with closing the school systems, keeping people and avoiding gathering in groups, and limiting restaurants to carry out. All of these things most Americans are right on board with. And I think it really speaks to how this has really touched all communities. Look, a lot of people, a majority of people didn't feel that they were going to be impacted in their community just a few weeks ago, and that certainly has changed.
Although I think, Jay, I don't want to have him do a Rick Perry from the Republican debate with you.
Yeah.
I think you said you had 3 things that struck you, Jay, and I think we only got 2 of them, if I was counting right.
I did. You jumped in after the second one to make a good point. Yeah, the third one is that and you just kind of hit upon it, Barbara, is that there is, I think, a pretty uniform sense that restricting travel, canceling events, and things like that, pretty much there's no partisan divide there. There is a big partisan divide still on requiring businesses other than grocery stores and pharmacies to close. And that's the other thing that struck me about this. And whether that's a regional thing or whether there is still a partisan thing there, that's what I wonder. When I see that closing businesses is kind of critical, according to public health officials, to creating the social distancing, the space and the distance that we need, according to, again, epidemiologists and public health officials, to flatten the curve, to make this less severe over a longer period of time so that the healthcare system can cope with it. That message has been repeated every place from the White House by Anthony Fauci to Governor Cuomo's news conferences. It's been repeated over and over and over. But this poll suggests that 61% of Republicans and leaning Republicans, only 61% think other businesses should close other than restaurants, but 81% of Democrats do. And I don't know what that's about, but it is striking that that's the last place that there's significant partisan divide.
Is that idea? Do you guys want to weigh in? Is it ideology or is it experience?
Yeah, my guess is that's still a sense of, the economy versus healthcare, and President Trump made that point, I guess, a week to 10 days ago now. Time is hard to measure, but. That would be my take on it. I had 2 points I wanted to add onto what Jay is saying, and one point you made, Barb, was the earlier was how things have changed so dramatically. And in our poll of a couple weeks ago, when we saw 18% of the country had said they'd either lost their work, family member themselves, or they had their hours cut back. Right now, a few days ago, in fact, 33% said to the Pew Research folks that they or an immediate member of their family had lost a job. 51% said work hours or pay had been cut back. And I think that speaks to just the dramatic change that's occurred. And then I want to make one other point, and this has to do with what Jay was talking about, with the snapshot. And I think, one of the things I'm looking at, and I know a lot of people are, is you're looking at the trajectories, these different models that are being advanced to say, well, how many people are likely to get sick, how many people are likely to be hospitalized, how many likely fatalities there might be. And I think, these are kind of like forecasts, and they're not different in a sense, although the topic is much more serious, but they're not really different than this kind of statistical forecast we see in politics. And I didn't know, Barb, whether you wanted to weigh in on forecasting a little bit, because I guess it has to do with the assumptions that go into this.
Well, I think one of the things that is very different in the forecasts that we're now seeing about COVID-19 is what we're struggling with in terms of what you remember from, fifth grade math is your denominator. In other words, what is the proportion of people that are likely to contract the illness, and then what proportion of them are to get seriously ill and die. So the difficulty with not having a denominator, and I think we saw this in places like China, where although there was a great deal of testing, there's a question right now by the healthcare community whether we actually had a sense of how great the number of people were that had contracted the disease, making the fatalities look very, very high. That's not to say that this is a very, very serious illness, but it's very difficult to forecast those kinds of numbers because we don't have a good number of how many people are actually contracting the disease.
Because a lot of people are not being tested in their home, and they aren't in those numbers. So the percentages
initially
get off.
we had trouble with the tests. Then we've had trouble with testing, and I know at least in areas where that have been harder hit, New York, Washington, California, only people who are really being admitted to hospitals are being tested. So even a lot of people who are going to either their doctors or calling their healthcare providers, they are being told that there may not be a test available, or that there's no really reason to be tested because their symptoms are clearly coincide with the symptoms of the virus. So we may never know the extent to which the number of people who have contracted the disease, but certainly it is can be incredibly debilitating. And again, the things we know are just correlations, and they're, in a sense, they're anecdotal. We don't have enough science behind understanding the who and the how and the where.
But we do know from the polls that most people in both parties believe in the public health experts. I think that they've, in a sense, become a group that people are relying upon, from the White House, the doctors who we see daily, and others, but the public health community. And they also have a great deal of trust in governors and their state and local officials. That's across party lines. Clearly, when you get down to the news media and President Trump, you get back, Jay, to what you were talking about was the partisan divide over, do you trust the news media? Do you trust President Trump?
And 68%.
The Trump numbers are not really surprising. 18% of Democrats, actually that is high for Democrats, right? 18% think that Donald Trump is doing a good job of responding. 83% of Republicans. But that kind of gets to the other thing we want to talk about, which is approval rating during this crisis, because there's been a lot of coverage, especially if you spend a lot of time in Twitter or in the political blogs. There is a lot of talk about his rise in his approval ratings across a number of polls that track his approval. What is that about, Lee? And what should we be looking at? One of the things when people mention that to me is I say, well, look at the quality of the polls, but the quality polls are finding very much the same thing, right?
Yeah, and I think that's a very important point, because we have spoken many times on Poll Hub about the consistency of the Trump numbers, and then all of a sudden we're seeing talk about a bump in his numbers, and is it real? Let me make a couple points on this. First of all, the numbers in Real Clear are only now for him a couple points, 2 to 5 points higher than they were. I don't think
I think
this
the
is
most recent average was between 47 and 48%.
okay. Yep. So he's a little bit higher than he was, but we've had other examples of presidents in crises and how their numbers changed. And I think to understand what this is about with President Trump, you have to look at the numbers that George Bush had after 9/11, where 90% were approving of his job performance. After the Gulf War, George Herbert Walker Bush in 1991, 87%. Go back to, in the Gallup numbers, to FDR's numbers after Pearl Harbor, 84%, and you go on and on and on. So when you compare the kind of bounce that those folks got in crises where the country pulled together, I think that puts a perspective on what Donald Trump's numbers are about. I think the numbers going up a little bit, have to do kind of like a unity feeling, maybe a little optimism that people would like to believe that this is going to be, the cavalry is coming, that there's relief in sight. But the numbers are not the kind that you want to write home about.
Yeah, we also took a look at comparing some of the approval ratings of world leaders as well, who are certainly these are current approval ratings. Just comparing how people in those countries feel about the leadership in handling the COVID-19 crisis. This one struck me as interesting. British Prime Minister Boris Johnson has a 72% job approval rating, and I know that they have had a number of difficulties in the UK, but he has also been out there talking and guiding people in terms of leadership across the country. Israeli Prime Minister Benjamin Netanyahu, 60% approve of his handling of the COVID-19 crisis, and German Chancellor Angela Merkel, 75%. So it gives some perspective. Certainly, President Trump is a much more polarizing figure in this country, and remains so even in the
Okay. Yes.
I'm sorry, Lee. You were going to.
No, I'm just so excited to make the next point. But finish what you were saying.
Just in the midst of this crisis, I mean, he still remains incredibly polarizing, and I think it may also have to do with the mixed message that we have gotten from the White House and from his administration. From not many weeks ago, it being compared to not quite the flu or just like the flu, and now the change of heart as to what may be facing
and the relief
people
that's coming or not coming to the medical community in terms of their protective equipment. And what I was going to jump in on was because someone who we've all watched for many years, and I know Jay in your prior life as a reporter interviewed many times, is Andrew Cuomo. And if you want to look at a bounce, even in this particular situation, the Siena poll has him at a 71% favorability rating, up dramatically from their previous poll. Andrew Cuomo has kind of filled the vacuum in some ways in terms of providing leadership, and those daily press conferences he has seem to be very effective in terms of public reaction. Jay, you know Cuomo better than us. So.
Cuomo's gotten the bounce. Cuomo's gotten the bounce that you would have thought that Trump might have gotten, in the same way that that George Bush got in the Iraq War or something like the Gulf War. That's where you would think that it would be Trump that would be getting this bounce, but it's Cuomo, not a particularly popular governor in New York, who is getting the bounce. And it's really hard not to conclude some of that has to do with substance, the actual substance of what's going on. And a lot of people have said he, in his daily news conference, is acting more like the president than the president is.
Yes, I've heard the phrase America's governor being used, borrowing the one when Rudy Giuliani was seen as America's mayor during the 9/11 crisis.
Well, he also has the biggest media market that he's also speaking to. And so the fact that he has taken such a strong leadership position and is having his daily updates along with PowerPoints and being very, I think also just very clear in terms of his message and what he is asking New Yorkers to do and how he's asking them to sacrifice.
Yeah, and it's very fact-driven, but it also appeals to family values. Obviously, his brother, Christopher Cuomo, is now also sick. But just when he talks about, the personal qualities of it, he in many ways is reminiscent to me lately of what his father, Mario Cuomo, was, kind of being able to personalize and make people feel a connection to the issues. Andrew Cuomo wasn't always like that.
That's the nicest thing anybody's ever said about Andrew Cuomo. He would love to hear you say that.
Well, he said today he referenced Pop and in his press conference earlier, and that's very important to him. And I think I think in New York we feel that leadership that he's providing because it's really again we are ground zero, unfortunately.
Hey, last thing, what would you tell people as they're looking at all these polls, especially about the approval ratings of the president, all that? What would you tell them to look for, to keep an eye on? Because one of the things that strikes me is that it's everything we've talked about in this podcast is ask me again tomorrow.
Yeah.
And so I'm just curious what you would tell people who are wondering about all these approval ratings and these numbers going up and down and all that.
I would say, ask me again tomorrow. I think that is exactly the case. And I think that, what they do tell us, and on the one hand, we're interested about the president, his reelection prospects and things of that sort, because that still is there a little bit more, of course, on the back burner. But we're also very interested in just the impact this is having on people's lives. And what the polls can tell us is exactly that. And those numbers are in a sense, very scary, not just in terms of healthcare, but in terms of the disruption to people's livelihoods, their day-to-day interactions. We're all feeling that. Everybody we talk to, I know so many people are working remotely. I even saw some numbers on that. 52% of those with a college education say they can work remotely. Only 4% of those with a high school diploma say that. So this is really an issue also. The illness goes across class lines, but people's ability to react, that still has the wealthier are doing, have more resources at their disposal.
And access. And we did also see those very stark differences when we were looking and hearing about hoarding of, food and supplies. Basically, if you are having difficulty making ends meet from week to week, you really don't have the option to be purchasing a lot of supplies, in the short run to make do. So it is a significant difference, more so in terms of income and education than even age, which we have heard so much about young people, not taking it as seriously. But I think we all are, or most of us are at this point. And one other thing is, I think that the polls are showing is that we are all so very much experiencing some part of this in some way, and it is very stressful. So hopefully there is some solace in at least acknowledging that our neighbors, even though we can't necessarily talk face to face, but that our neighbors are experiencing similar difficulties, and to think community and to look out for one another and to try to do things that are less stressful. Perhaps not watch as much news. I know there's some solutions journalism as well, that instead of speaking to the dire problems that we may be facing, they focus a little bit more on some of the solutions that you might be able to take to reduce the stress and to kind of things you can do while you are at home and staying put. So I think that those are things that we can also look to.
Yeah, and before we end, I just wanted to say, we're all feeling this in so many different ways. We're at a college. We're now doing online courses here at Marist, but clearly we are not getting a chance to send our seniors off in the way we had hoped for. And a lot of them have been reaching out to me and others, I'm sure, about what Marist's experience has meant to them. And they're sort of saying to us, well, thank you so much. And I just want to say to some of them, we feel that too. And we feel that, that lack of closure. So the bottom line is you're going to graduate, but you got to come back and visit when this cloud passes, because we haven't had a chance to really say goodbye.
We have some creative ways also to recognize their accomplishments. I'm not sure we will all be on the big lawn in front of the Hudson River this year in May to graduate. But I know there are a lot of plans to virtually recognize and acknowledge the 4 years that the students have worked at.
And I've learned how to even do Zoom. Jay, you're surprised
and
by
WebEx,
that. And WebEx. Jay, are you shocked by that?
No, not at all.
Anyway, that will do it for this edition of Poll Hub, a production of the Marist Poll at Marist College in Poughkeepsie, New York. And Mary Griffith is our tried and true executive producer, and Casey Schaff, our excellent editor.
And thanks to the Roper Center Archive at Cornell University for providing us with the ability to look back at survey questions and results over the decades, particularly all of this information that we have had on past presidents and other crises that we have faced as Americans. And if you have questions or comments, reach out to us on social media. We're there at Marist Poll on Twitter and Marist Poll on Facebook and Instagram.
And thanks for listening this week and every week. Obviously, with many of us working from home or staying at home, there's more opportunities to watch podcasts, to listen to podcasts, If you enjoy what you hear, leave a review or let your friends know that Poll Hub is out there. Also, if you have time to kill and you are looking to learn more about polls, we have an online academy called the Poll Hub Academy, and it's free. The URL is in the show notes, but it's academy.maristpoll.marist.edu, and you can go there and learn all about polling in ways that you can impress your friends at the first cocktail party or dinner party that you have once we all get to see each other face to face once again. Stay safe, everybody, and we'll talk to you next week.